Hello, this video is for Aspen University's Essentials of Nursing Research class with Professor Leanne Prevenost. I am Sharice Abram, and this simulation is to educate our clinical staff on the strategic plan for implementing medical marijuana to our fibromyalgia patients on the unit. A few weeks ago, the question was posed: is medical marijuana, compared to other prescribed medications, more effective for treating fibromyalgia? And since that question has been posed, marijuana has become legal in the state of New York. So today, we are going to discuss implementing medical cannabis to our patients on the unit who suffer from fibromyalgia and other chronic pain conditions. So, since the legalization of medical cannabis, one key change to medical marijuana's regulations involved the fact that it grants doctors and nurse practitioners the ability to use their discretion when certifying patients. They no longer have to fit a restricted list of health conditions such as cancer or epilepsy. So, as a team, what we are going to do is we're going to compile a list of eligible candidates who may benefit from the use of medical cannabis to manage their pain. We're going to give this information to the providers for a full assessment, and we're going to base our recommendations based on Ida Jean Orlando's deliberative nursing theory. Now, this theory states that it allows nurses to create an effective nursing plan to focus on not only finding out, but also meeting the patient's immediate needs for relieving pain. That's essentially what we want to do to provide the patient with relief. So, all of us may know that some of our patients continue to complain about effective pain management and effective pain relief with the FDA approved medications such as Lyrica, Duloxetine, and also Savella. By introducing medical cannabis, that not only benefits the patient by reducing or eliminating opioid use, but it can also benefit all of our staff by reducing the med pass, by reducing the amount of time that it takes for the interventions, other interventions as far as trying to manage the pain. So it's a win-win for everyone involved. Now, cannabis is still very controversial. It can be a controversial topic. However, we will overcome barriers to implementation by providing evidence-based data on the positive effects of pain relief. These patients are suffering from chronic pain. They cannot get out of bed sometimes. And unfortunately, sometimes the intervention has to be curtailed to an individual plan. We will conduct a trial period where selected patients will be administered medical cannabis on a scheduled basis. So what this does is it'll allow us to assess the patient's pain relief and also the improvement of any depression or anxiety that they may also be experiencing. The patient is the best source of information when it comes down to evaluation. So, evaluation will consist of monitoring their energy level, pain, and fatigue are the main symptoms of fibromyalgia, and it can limit their ability um, to complete their activities of daily living. Once the pain is managed and fatigue is addressed, patients can then begin to have a better quality of life. And that's essentially what our goal is. Now, ethically, recent surveys have indicated that there's a significant knowledge gap, okay, about the effectiveness of medical cannabis among practicing physicians. And although many physicians and providers believe that medical cannabis can indeed be helpful for patients, there's a minority that have sufficiently been informed to make recommendations due to physicians just not being educated on medical cannabis in medical school. So, moral and political sentiments tend to trump evidence based considerations at times. So, our goal is to implement this strategic plan, assess, reassess, and evaluate the positive effects so that change can possibly be made for those that it is effective for. Um, it may not be effective for everyone. Everyone may not be open to it based on their biases, but the plan is to do the trial, allow the opportunity and the autonomy for residents and patients to choose to have the option, and continue the treatment for those that it's effective for. Thank you. My references consist of prescribing medical cannabis, ethical considerations for primary care providers, Journal of Medical Ethics, London, Volume 46, Issue 4, by A. Glickman and D. Shish, 2020. Also, Medical Cannabis, The Canadian Perspective, Journal of Pain Research, Volume 9, by G. Cole, S. Bober, S. Mindra, and J. Moreau, 2016. Safety and Toxicology of Cannabinoids, Neurotherapeutics, New York, Volume 12, Issue 4, by J. Sosh, E. McGlad, D. Yanglutad. That's from 2015. We also have Current and Emerging Pharmacotherapy for Fibromyalgia. That is by R. Trazadok and J. Ablin. That is from 2020. We have Adverse Effects of Medical Cannabinoids by T. Wang and J.P. Colette, along with Shapiro and M. Ware, 2018. That's a systematic review. And last but not least, we have Nursing Theories and Theorists by G. Wayne, 2021. Thank you for taking the time to watch this video, and you have a great day.